It gives me immense pleasure to be able to sign yet another dollar credit line agreement with representatives from the government of India. Indeed, it was just a few months ago, in February, that I signed a similar agreement with Mr. Prasad in Washington for the acquisition of fixed and mobile drainage and irrigation pumps to service Georgetown and its environs. Through the signing of this agreement, the government of India will provide financial assistance amounting to $17,500,000 United States dollars to assist our government to upgrade and modernize 3 regional hospitals. The resources will be used to refurbish existing facilities and construct new buildings at the Saudi Regional Hospital in Region Number 2, West Demerara Regional Hospital in Region Number 3, and the Bartico Regional Hospital in Region Number 7. Additionally, medical equipment will be procured to furnish the new and renovated facilities. When completed, residents of the immediate and surrounding areas can expect to benefit from improved healthcare delivery and service. The provision of quality healthcare remains the primary objective of this government. An effective public health system is essential to providing care for the sick and for instituting measures that prevent diseases and promote the general well-being of the Guyanese populace. The upgrade of the aforementioned facilities will ease the burden currently placed on the Ministry of Public Health's budget, since the ministry is responsible for evacuating hinterland patients to the Georgetown Public Hospital Corporation for highly specialized care during emergencies. As observed over the years, many residents of the outlying regions prefer to seek medical attention at the Georgetown Hospital, believing that the services provided there are superior to those provided by the regional healthcare facilities. This intervention is expected to change that perception, while allaying fears about the quality of the regional health systems and facilities. The signing of this agreement is yet another gesture of the government of India's support for Guyana's socio-economic development, since the two sides established diplomatic relations on May 26, 1966. Current areas of bilateral cooperation include the establishment of a Center of Excellence in Information Technology, which will offer training to professionals in public sector in the areas of information and communication technology in order to develop their competencies, and the construction of a bypass road between Ogle on the east coast Demerara and Great Diamond on the east bank of Demerara, for which a consultancy company is currently reviewing the feasibility study. Meanwhile, tenders for an ocean-going ferry vessel are being advertised by the government of India. Construction of the ferry, which will ply the Georgetown Port Kaituma route, will begin as soon as a successful bidder is identified. As mentioned earlier, support for the agricultural sector will be manifested through the supply of drainage and irrigation equipment and related spares for Georgetown and its environs, as well as institutional strengthening for the relevant staff of that ministry. Other areas of assistance being provided by the government of India include the provision of renewable energy equipment in the form of a rice husk gasifier, and the continuing training of Guyanese human resources in relevant specialized fields in India. The government and people of the Cooperative Republic of Guyana extend their appreciation to the government and people of India for their continued support for our country's developmental efforts.
That the Ministry of Public Health wishes to thank the government of India and the Export-Import Bank, EXIM, of India's Washington office for approving a line of credit of US $17.5 million for the modernization of primary healthcare system in Guyana. I wish to assure you, Ambassador, that this line of credit will be utilized by the ministry to help in the fulfillment of its mandate of enhancing the delivery of primary health care in Guyana. It is my belief that this is the most important level of health care, and it is incumbent on the health sector to interact with our people to ensure that we deliver comprehensive services, including prevention, promotion, rehabilitation, and palliative care. It is our intent to ameliorate the services at our health centers and clinics, since these facilities play a critical role in a population's health. Our Health Vision 2020 prioritizes a working and comprehensive primary care program, since we recognize the impact that such a service has on the health status of individuals. The ministry wants to ensure that this service reaches all our communities and that we cater adequately for their needs. I wish once again on behalf of the Ministry of Public Health to reiterate my thanks to the Government of India and EXIM for this line of credit, which undoubtedly further the cause of primary health care for our beautiful nation.
Today we have assembled here to sign the line of credit agreement for 17.5 million US dollars, which will be meant for three primary hospitals in West Damerara Regional Hospital and Batika Regional Hospital and Suddhi Regional Hospital. We have already conveyed the list of companies which can act as project management consultants, which will eventually prepare the detailed project report. And then one of the companies which have been given by Exim Bank will be chosen as primary project management consultant who will prepare the detailed project report, and then the project will take off. I'm sure that the process of choosing one of the companies as project management consultants will be done soon. Today, on behalf of Exim Bank of India, Mr. Sailesh Prasad will sign the agreement on behalf of Government of India too, and of course from the Government of Guyana side, Honorable Minister of Finance, I suppose, is expected to sign.